And I think what's really important to me about that is that champion network is going to be about sharing practice locally, because what we're talking about here is how can a national offering help with local engagement and the way in which practice works at a local level. And we're already starting to see from some of the work that we're doing with practices on the ground by putting our team into those practices, different ways of working in different practices. And if we can share some of those ways of working, then people can consider what might be the right way of doing things for their practice. And thank you to everybody who's putting the questions into the chat, by the way. I can see they are coming in thick and fast. We've got over 30 questions in there at the moment, but only a couple of people on the other side of the screen tapping away with the answers. So we will try and answer everything in the questions as we go. If we don't get a chance to answer it today, we will absolutely be following up with the answers to those questions, and I might put one or two of those to some of the product team if we've got time towards the end of the call. But it's all right us saying this, but kind of NHS England would say that, wouldn't they? So I'm really pleased to welcome our two guests onto the call today. We've got Nicola Frisby from NHS South, Central and West CSU. That CSU keeps growing to, I still think of it South and West, got Central in there as well now. And Adelina Pashova, who is the Digital and Transformation Lead at Harrow East PCN. We'll talk a little bit about their experiences and why they've come on the call today. And if you've got questions for Nicola and Adelina, put those in the chat as well, and we will try and get to them as much as we can. Although, as I keep saying this, I can see the number of questions ticking up as we go. So Nicola and Adelina, welcome to the call today. I'm just going to ask you to briefly introduce yourself and why you were keen to talk with people about GP registration. Adelina, I'm going to come to you first, please.
Thank you, Nick. Thank you, everyone, and thank you for the opportunity for me to speak here today. Very quickly, my name is Adelina. I'm the Digital Transformation Lead for Harrow East PCN, as already Nick mentioned. I've got nearly 10 years behind my back within NHS, started as a receptionist, and just to recap everything what was said till now, I remember those days when people were required to come at specific times in order to apply to register with the practice or to pick up their papers and so on. Also the absolutely enormous amount of paper that was printed weekly, daily, and it was handed out. The risks of obviously lost papers, etc. So very quickly, the online registration, when the idea came up, I was very pleased to hear it. And then when the opportunity arose for me to actually implement it, I was really happy. The partners at Honeypot Medical Centre welcomed the idea very warmly, and I did it within a couple of weeks since I joined the PCN. The staff was really happy, the patients were really happy, and just as a feedback, a real-time feedback, there was a mum sitting in the waiting room and she had just given a birth. When I told her about the new option, she just went straight away on her phone, completed the registration within 3 to 5 minutes, and it was really pleased with the service. Really easy, really nice, and also very easy for the practices to set up. Don't be afraid to implement it. It really does work. That's for me.
Thank you, Adelina. And Nicola, would you like to introduce yourself and say a little bit about your experience here? I hate to be the one to do it, but you're on mute.
Always the way, right? Always. There has to be one, right? Hi, I'm Nicola Frisby. I worked in primary care since 2013 and have now turned patron gatekeeper because I now work for the CSU. I'm on the call to we're trying to get one of my areas, Somerset, to take the service on more so than we are at the moment. We've got some on there and we're doing some more. And from my previous role, just before I joined the SCW, I can see such a huge benefit of how this would save time. I noticed one of the questions was, how does it save time? What I found, I used to do data mining for QOF, which I'm sure you all do from January to March. And I would find for child vaccinations, lots of children with no family or household members on EMIS. I can only speak for EMIS actually, because I've not used TPP. But yes, you would find children, so you clicked on the household button on EMIS and there's no family. How do you get their vaccination record? This service allows people to translate the form. So it's so much easier if English isn't your first language. So they're going to know that the surname is their surname rather than they fill it in the wrong way around. And also when they're coming in from different, if they're not a UK national, if they're not born in the UK, we need to know when they arrived in the UK, but also we're allocating them an NHS number then. And it's not a great service if they arrive in the UK and their name's the wrong way around. It's not great. But that's my introduction. So I can, Nick, sorry, do you want me to go on with my hints and tips or?
Please do, go straight for it. And,
So this is the stuff that I found. So we would also find that people, if they had quite large families, they would have form filling fatigue. So you start to write, your writing starts to get less and less legible. And if you use script writing, it's very difficult to read, and it's difficult to, they start to use abbreviations, roads, streets, things like this, because they filled it in like 3-4 times. And then it gets more and more difficult to know that these are together. And especially if they're using, the first name as their surname and you're getting it the wrong way around, you can't even link up the surnames. I also used to find lots of, email addresses were quite difficult to read if they were sort of done joined up writing. And also ones, L's, those sorts of things would be difficult to decipher. And if you haven't got that email address, how can you email them to say, we haven't got the correct details? So if you type it out on this form, it's so much clearer. You've actually got a pure contact for that patient, which is brilliant. Similarly, we used to have a lot of Eastern European folks, and I'm a quarter Italian myself, but if you, the ones, they tend to have like the tail of the one at the start, which sometimes looks like a 7. And if you put that into the form, that's confusing. Similarly with 7s, you can have 7s with bands across, and sometimes they look like 3s. Now, if you have mobile numbers with lots of 7s and 3s in them, the permutations to try and get that number correct to contact that patient is just too high, so you can't contact them. So you can't use AccuRx, you can't contact them. The only thing you have then is post to contact that patient, and that's quite difficult. So that's how it would save time trying to chase those things. The form also helps you. It says if you're not a UK national, or if you weren't born in the UK, it asks you for the date you entered the UK. That's what we would find, as a lot of time was spent trying to get that date. And we were sat on the registration. It doesn't delay the registration for those sorts of details which you need for EMIS. Also the PDS, it tells you if they've linked to PDS. So it's really handy to know that you can find it. Sometimes you do a registration and, I can't find them. I can't find them on the spine. But if you know that they have been found on the spine, you can persevere, and you should be persevering anyway, but you know that it's there because someone else has found it. Also, we used to have, and I'm sure everybody has it in their own surgeries, different people use the EMIS form, and again, I can only speak for EMIS, use the EMIS form differently. So they sometimes put their house number in the flat number house name, and then the address, and then sometimes they put the counties in and other people don't. EMIS is very particular, and it will only ever match for the household if all of those things are correct and all of those things match. If you have these emails come through, and I would suggest doing a dedicated email address purely for this service, which you can request from people like me. But if you have a dedicated email, you'll be able to see clusters of emails coming in, so they're more likely to be together. You can see from the date, time, and stamp. So it's easier to notice if things are submitted very quickly and in line. And But because of that, you've also got the people who do fill in those forms slightly differently. Chances are they'll be able to fill in the same number of forms. So even though they do it differently, they will still come up as the household. And it's just a great patient experience. We had, in my previous surgery, we had a QR code online form, but it wasn't as sophisticated as this. And it was a great patient experience because they didn't speak English as their first language. And it's very difficult with a language barrier for them to come in and ask. And whereas a QR code is like, it crosses all boundaries. Everyone knows what a QR code is. So if you point to a QR code, they know that they can scan that and it takes them to a form. Then they can translate the form. So there's no sort of, it feels like you're being helpful because there's no language barrier there. And it's a great patient experience, really. And also with the dates of birth, that's another thing we used to find. If you have a date of birth which is like 7th of September, it could easily be 9th of July. And that's difficult. Unless it's 13 or over, it's really obvious where the date of birth is. But again, we're registering people who are perhaps joining the UK for the first time and their NHS details are incorrect. And how do you argue or how do you put your point across if English is your second language and that your details are incorrect? So it just minimises those errors, which actually take quite a long time to rectify. So just in answer to the question, how does it save time? Yes, it might not save time per form for 10 minutes, but trust me, it will save a massive amount of time in the long run. And that's me over and out. Thank you for listening.
Thank you, Nicola. There's a lots and lots to pick out from there. So one of the areas I'm seeing a lot of questions around, is, well, a couple of those. One is around the time saving, and the other is around, well, we have some local questions. We have a healthcare questionnaire. Maybe we want people to check in for an initial visit when they register with our practices. That balance between the national core, if you will, which is common to every practice, and the things which happen locally. Adelina, in the practices in your PCN, how have you found that balance? How's that worked for you?
For the balance between the online registrations and the paper or the transition.
Yeah. So for instance, is there any extra information that your practices require locally that's in addition to what the National Service provides, and what do they do with that?
Oh, sorry. So the Honeypot Medical Centre has got a very long-winded health questionnaire, etc. And I have been trying to really push to switch to the form that was created to match the online registration form, because to be fair, loads of those details are kind of dated. I know that all the GPs are like to have all this information, etc. But to be honest and really open about it, probably the key point would be the smoking, the drinking and medications the patient is on, because realistically, when they come for their first appointment, the GP or the HCA would check all of these other questions, and some practices even have got like a NHS health checks when you're registering a new patient. So I think in terms of to improve generally patient experience, we as NHS should move a little bit forward to more digitalized, more concise questionnaires, and we should probably reduce the amount of questions that the health questions that practices to still tend to tailor. But that's, of course, my experience, feedback which I have had from patients, feedback from staff members that are entering the registrations and all this information. It's just a lot of tick boxes that very frequently don't even come handy or useful, because then the GP sees them and overwrites half of this information, because sometimes people say, yeah, I don't smoke, but then when they see the GP, actually they confess that they smoke 5 cigarettes a day or 5 cigarettes a week. So sometimes questions are filled just as a tick box by patients. And I think having the online registration matched with paper, whereas Nicola and other people raised, email addresses are legible. You can see exact email address, the contact numbers, and also families being safe. They're feeling 6, 7 forms at the same time is massive. Just this is not a joke. I had a family, a gentleman with 4 wives. I'm not joking. This was a family of 46 people. I'm not joking. That was family of 46 people, 4 wives, and I don't know how many kids with each wife. I can't tally up the total. I'm not joking, and this is happening in London. Imagine this guy, I think it took him about a month until he registered all these 46 people, and all these 46 people were with the same number. It was absolute total hassle. And what Nicola said about surnames, names being confused, etc. So I think what you have created is amazing, and if more GP practices and ICBs can move forward and just keep it short, concise, easy for the patients, especially for people where English is not first language like mine, I think you're going to make everybody's life easier. Receptionists, patients, and GP partners as well. That's what I can say.
Okay, thank you. And I think it's worth saying that this has been a process which has been evolving over time. You mentioned around smoking and alcohol questions. I don't think those were in at the very start of the process. We listened to the feedback we were getting from practices, and those were put into the form. But there's always going to be a lot of variability. Yeah, so some practices ask for a relatively small amount of information. Some practices, as you've alluded to, have extensive questionnaires and other information that they want to send out. And we're trying to find a solution that balances that and lets those that want to send additional information do that. There's always going to be that space for a local element where that's the thing that's needed. I've seen some of the questions in the chat around catchment areas, and again, some practices have really strictly enforced catchment areas. Other practices don't actually use a catchment area at all, and we cater for both of those. Some of the questions are around the time saving. So, Nicola, I'm going to come to you for this in just a second. And I think you've alluded to that the time saving probably falls into a couple of different areas. There's the data entry bit, if you will, which is quite visible, and that's where that integration piece is going to become really be really powerful. But there's also some time savings at the back end with the exceptions that would normally come back into a practice when they've performed a registration. And we're showing a 60% reduction in those exceptions. What did that mean when you were a practice manager? What had to happen in the practice to deal with those exceptions for a registration?
That mean? Oh, it takes a long time to sometimes you have to go back to PCSE, but it's just lengthy, and you need to find the information from the patient. Sometimes you have to go 3 years addresses because you can't, especially if people move around, you can't trace them on the spine, and that's difficult because that means GP to GP won't load, which means you don't know their health record. And when I was data mining for the vaccinations, it's really difficult to find a parent for a child if they're not on the household. You then have to do a postcode search, literally to just find someone on the same address, and then you're looking, and that's when you started to find surnames were incorrect. But you've then got to fix all that, and you have to. So when it all works fine, it probably isn't saving a huge amount of time, but it is saving time for the patient, don't forget. It is a lot quicker and a lot more convenient to fill it out online in your own time, in your own language, than it is to find time to visit a surgery, even with extended hours, after work with your children if you're a single parent, and fill in those forms. So the time saving is for the patient also, but in terms of when you have errors and other things that reject when your registrations are rejected, that is a lengthy process, and anyone on the call who's done those know that sometimes they can sit there for weeks and it's not a nice process, and that's where you save the time because you've got accuracy from the start rather than just ambiguous stuff, which is no one's fault. It's just reading it wrong, Adelina, I'm sure you'll agree.
Adelina, anything you'd like to add to that?
I think Nicola summarizes very well. What I can I remember those days where I have to go back with PCSE on names, etc., and one digit different or duplications of registration, but also to go back to Nick's point about the outside of the catchment area and the process and what you need to do. Different practices would deal with it differently, I presume. Some, for example, some practices have signed up and they like to register people within like 1 or 5 miles outside of their catchment area, their boundaries, which they're set on the website. Some practices would say, as Nick pointed out quite correctly, no, we don't want anyone. So, for example, with us is our practice, particularly Honeypot Medical Centre, they've got an additional paper which says this may not happen due to the fact that you're outside of the catchment area. And if you agree, you can, for example, join our practice. So with the online registration, what is added to our workload, and it's still there, yes, we can accept it. It will show us that it's outside of the catchment area, but we will still follow the internal protocol, whether when we're registering them, we'll check their postcode, we'll see whether they're outside of the catchment area, and if they haven't filled the paper, we're going to send them an Accurex or an email to say, this is the form, can you please sign and return back. But this is our practice. I'm sure there are about 6,000 practices in England. Everyone has got different ideas and processes and better ways of doing it. So there are ways to work around it, but I'd still see it as a less spending time to send them an email or give them a quick call, because you would have more likely the correct email address or a number versus having the paper registration in front of you. And I think you can just copy paste, and you can copy the email address from the PDF you get, and you can just even press the forward button and attach your consent form. And actually once when you've got the form done, then you can process the registration. Actually, you can have just a little folder which says waiting further information, which still, I think, saves a lot of time. You don't even need to physically call. You can just do it all electronically without still patient visiting the practices. But this is kind of like personal experience.
Thank you, Adelina. And that leads me nicely, actually, because just as you were talking, I saw one of the last questions, and I haven't seen all the questions because there have been so many. So thank you, everybody, for sending in so many fantastic questions. Someone was saying, I still don't get the basics of this. So once somebody has completed their information, it comes through to the practice as a PDF, but also as a structured message. And it's from that PDF at the moment that people can cut and paste that information into their clinical systems and speed up the process that way. But that structured data can be used in other ways as well. Now, there's some questions in the chat around Health Tech One. Hassan, I know you wanted to come in and talk a little bit about that, please.
Yeah, so what we do is we also collaborate with Health Tech One. Health Tech One has their own form, but they're also built into our form. So if you're going down the automation route, you can actually ask Health Tech One to put you on the national form. That way you get the added benefits which they don't have. They don't have integration into the NHS app. They don't have access to find a GP button. They don't have access to the spine to be able to retrieve NHS number match rating for you like we do. There are all these added benefits that's only exclusively to our service, which the Health Tech One cannot do. Yes, they can do for you other things like customizable questions, but they don't tap into other national services. And we're just beginning. This is just one step in the process. And since there's also the mention of the service on the recovery plan, it's specific to our service. So if you want to do the Health Tech One, you can, but you can also tell them we want it with the national service. And that's really quickly what I wanted to do because we're in our last minutes.
Thank you, Hassan. And I should say that Health Tech One are one of a number of RPA processes that we are working with. We have no affiliation with any of them. It sounds like the BBC here saying other RPA providers are available, and there's a list of all of those on our website, and someone can drop the link to that into the chat. Now we're coming into the last 5 minutes of the session today. We've had some fantastic questions, and I mean, and I've been watching people trying to the team frantically trying to respond to them. I think we're up to 73 at the moment, which is quite incredible. I don't think we've seen anything quite like that before. We will try and get to all of those, and we will send them around if we don't have the opportunity to fit them in the next few minutes. I did want to say a huge thank you to Nicola and Adelina for coming in and sharing their experiences. We put great importance on what practices and ICBs are telling us, because we have the national product here, but it doesn't do anything until it's in the hand of local practices, of local primary care services. And so the way in which it affects you and affects your patients is of absolutely central importance. We take that feedback incredibly seriously, and that's how we drive improvements in the product. That's how we end up with a 93% patient satisfaction level. And thank you for doing that. If you want to sign up for the service, there are details in the form, or contact any of the email addresses or the people you've heard speaking today. We'd be very happy to add you to the 1,600 practices who already have online GP registration with the national offering. Now, as we start to bring this to a close now, I'm going to hand over to Liz to talk a little bit about the practice management community, and say thank you very much for your time today. And if you do have any more questions, or if you want to follow up at all, just reach out to any member of the presenting team or any of the email addresses that have been posted into the chat. Over to you, Liz. Thank you.